Welcome to iemmaus Health and Wellness Hub. Are you concerned about the vegetables you're eating? Today we're diving into an important topic for our senior viewers, vegetables you might want to avoid. Yes, you heard that right. Not all veggies are created equal, especially as we age. Our bodies change, and certain compounds in otherwise healthy foods might start to cause issues we never experienced before. It's not about demonizing vegetables. They are, by and large, fantastic sources of nutrients. But it's about being informed and making smart choices that support your health and well-being in your golden years. Some vegetables contain compounds that can interact with medications or exacerbate certain health conditions common in seniors. Our goal today isn't to scare you off your greens, but to empower you with knowledge. Let's get into it and uncover what the science says. First up on our list are the nightshade vegetables. This group includes potatoes, eggplants, and all kinds of peppers. They're staples in many cuisines and packed with vitamins. However, for some seniors dealing with inflammatory conditions like arthritis, nightshades can be problematic. The concern revolves around compounds called alkaloids, one of which is solanine. In high concentrations, solanine can be toxic, but the levels in foods are generally safe. However, even lower levels might contribute to inflammation or exacerbate joint pain in sensitive individuals. If you're experiencing unexplained aches or stiffness and consume a lot of nightshades, consider exploring this with your healthcare provider. Nightshades also contain lectins, which can interfere with nutrient absorption and irritate the gut lining. The response to nightshades is highly individual. If you suspect nightshades might be an issue, an elimination diet under the guidance of a doctor can help. Cooking can reduce some problematic compounds, but not all. For peppers, capsaicin can cause digestive upset for some seniors. Listen to your body and discuss with your doctor if you have persistent inflammatory issues or digestive sensitivities. Next, let's talk about cruciferous vegetables. This family includes broccoli, cauliflower, Brussels sprouts, kale, cabbage, and bok choy. They are lauded for their high fiber content and cancer-fighting compounds. The primary concerns are their potential impact on thyroid function and their ability to cause gas and bloating. Cruciferous vegetables contain goitrogens, which can interfere with thyroid function in large amounts. For seniors with an underactive thyroid, consuming large quantities of raw cruciferous vegetables could exacerbate their condition. The more common issue is digestive distress due to a complex sugar called raffinose. As we age, our digestive enzyme production can decrease, making us more susceptible to these issues. Starting with small portions and ensuring they are thoroughly cooked can help. Consuming them as part of a balanced meal and chewing thoroughly can also mitigate discomfort. Digestive enzyme supplements can provide relief, but consult your doctor first. Approach cruciferous vegetables mindfully to reap their benefits without suffering side effects. Pay attention to how your body responds and adjust your intake accordingly. Let's move on to spinach. Spinach is packed with iron, vitamin A, and antioxidants. However, for seniors, its high oxalate content and significant amount of vitamin K are important considerations. Spinach is high in oxalates, which can bind to minerals like calcium and form crystals. For those susceptible to kidney stones, high oxalate intake can increase the risk. Cooking spinach can reduce its oxalate content. Spinach's high vitamin K content is crucial for blood clotting. For seniors on blood thinners like warfarin, consistent vitamin K intake is vital. Sudden changes in vitamin K intake can interfere with medication effectiveness. Discuss your spinach intake with your healthcare provider if you're on blood thinners. Spinach is nutrient-dense, but seniors need to be strategic about its consumption. Understand potential interactions and manage your intake wisely. Consult your healthcare team to ensure it remains beneficial. Beans and legumes, lentils, chickpeas, black beans, kidney beans, they are fantastic sources of plant-based protein and fiber. However, for seniors, they can cause digestive issues like gas and bloating. The main culprits are complex carbohydrates called oligosaccharides. Our digestive systems lack the necessary enzymes to break these down. As we age, enzyme production can decline, making us more sensitive. Proper preparation methods can reduce these issues. Soaking dried beans and rinsing canned beans can help. Cooking beans until very soft also aids digestion. Introducing beans gradually can allow your system to adapt. Some legumes are better tolerated than others. Using digestive aids like ginger or enzyme supplements can offer relief. Approach beans with strategy to enjoy their benefits without discomfort. Finally, let's discuss garlic. Garlic contains powerful compounds like allicin, credited with cardiovascular benefits. However, for seniors on certain medications, its blood-thinning effect is important. Garlic can interfere with blood clotting, especially in large amounts or supplements. For those on blood thinners, this can increase the risk of bleeding. Discuss your garlic intake with your doctor if you're on such medications. The amount used in cooking is generally safe. High-dose supplements or large quantities of raw garlic are the main concerns. Inform your surgeon about garlic supplements before any procedures. Garlic can also cause digestive issues for some seniors. Cooked garlic is often better tolerated. Respect garlic's power and ensure its use is safe for your health. Open communication with your healthcare team is paramount. And there you have it, 5 vegetables that seniors might want to think twice about. We've talked about nightshades, cruciferous veggies, spinach, beans and garlic. Remember, the goal isn't to create a list of forbidden foods, but to highlight potential sensitivities. Individual responses to food can vary greatly. If you suspect a particular vegetable is causing issues, investigate further. Consult with your healthcare provider before making major dietary changes. We hope you found this video helpful and informative. Stay healthy and see you next time. Please subscribe, comment, and share for more helpful health tips.